हेलो स्टूडेंट्स, आरजी स्टूडियो चैनल में आपका हार्दिक स्वागत है। मेरा नाम राहुल है, मैं एक टीचर हूँ। इस वीडियो में मैं आपको MPH मास्टर ऑफ पब्लिक हेल्थ एंट्रेंस एग्जाम के लिए महत्वपूर्ण 20 मल्टीपल चॉइस क्वेश्चंस MCQs क्वेश्चंस की जानकारी देने जा रहा हूँ विद एक्सप्लेनेशन, जो कि विभिन्न यूनिवर्सिटीज और इंस्टीट्यूट्स के लिए होने वाले MPH मास्टर ऑफ पब्लिक हेल्थ एंट्रेंस एग्जाम के लिए बहुत यूजफुल है, जैसे कि एम्स, PGI MER चंडीगढ़, TISS मुंबई, JIPMER पौंडुचेरी, IIPS निम्हांस बेंगलोर, JNU हैदराबाद यूनिवर्सिटी, ICMR और अदर इंस्टीट्यूट और यूनिवर्सिटीज जिनके लिए MPH मास्टर ऑफ पब्लिक हेल्थ एंट्रेंस एग्जाम होता है, उन सभी के लिए वीडियोज बहुत अधिक उपयोगी है। और जो कैंडिडेट्स MPH और अदर कॉम्पिटेटिव एग्जाम्स की तैयारी कर रहे हैं और इसके लिए इंपॉर्टेंट क्वेश्चन के PDF नोट्स लेना चाहते हैं, ऑनलाइन कोचिंग ज्वाइन करना चाहते हैं, वो 9411513974 पे व्हाट्सअप कर सकते हैं। 9411513974 पे व्हाट्सअप कर सकते हैं। और कॉम्पिटेटिव एग्जाम्स की तैयारी के लिए एक व्हाट्सएप ग्रुप बना रखा है, जिसका लिंक आपको डिस्क्रिप्शन बॉक्स में मिल जाएगा। चैनल को सब्सक्राइब अवश्य कर लें ताकि इंपॉर्टेंट क्वेश्चन के वीडियो मिलते रहें और विभिन्न जॉब्स और एडमिशंस के लिए जो नए अपडेट्स आते हैं उसकी जानकारी मिलती रहे। वीडियो को लाइक, शेयर और कमेंट जरूर कीजिएगा। यहाँ पे फर्स्ट क्वेश्चन है, बर्डन ऑफ डिसीज इज मेजर्ड बाय ऑप्शन है ए डिसेबिलिटी एडजस्टेड लाइफ ईयर्स DLY, B फिजिकल क्वालिटी ऑफ लाइफ ईयर्स PQLY, C हेल्थ एडजस्टेड लाइफ ईयर्स HALE, D ऑल ऑफ द अबव। करेक्ट आंसर ऑप्शन ए डिसेबिलिटी एडजस्टेड लाइफ ईयर्स DALY। क्वेश्चन नंबर फर्स्ट है, बर्डन ऑफ डिसीज इज मेजर्ड बाय। बर्डन ऑफ डिसीज इज मेजर्ड बाय, करेक्ट आंसर है ऑप्शन ए डिसेबिलिटी एडजस्टेड लाइफ ईयर्स DALY। एक्सप्लेनेशन है, the sum of mortality and morbidity is referred to as the burden of disease and can be measured by a metric called disability adjusted life years DALYs. DALYs are measuring lost health and are standardized metric that allow for direct comparisons of disease burdens of different diseases across countries between different populations and over time. So burden of disease is measured by, correct answer option A disability adjusted life years DALY is correct option. Second, a baby is called low birth weight if he measures less than option A 2.2 kilogram, B 1.5 kilogram, C 3.5 kilogram, D 2.5 kilogram. Correct answer option A D 2.5 kilogram. A baby is called low birth weight if he measures less than 2.5 kilogram. So if a baby is at the time of birth, if baby's weight is less than 2.5 kilogram, then the baby is called as low birth weight baby. Its explanation is, low birth weight is a term used to describe babies who are born weighing less than 5 pounds 8 ounces 2500 grams. An average newborn usually weighs about 8 pounds. A low birth weight baby may be healthy even though he or she is small, but a low birth weight baby can also have many serious health problems. Next question, most common diarrheal agent for infant is A rhinovirus, B rotavirus, C enterovirus, D E. coli. Correct answer option B rotavirus. Most common diarrheal agent for infant is, correct answer option B rotavirus. Explanation, rotavirus and Escherichia coli are the two most common etiological agents of moderate to severe diarrhea in low income countries. Other pathogens such as cryptosporidium and shigella species may also be important. Location specific etiological patterns need to be considered. Next question, denominator of annual parasite index API is option A total slides examined, B total confirmed cases, C total parasite load, D population at risk of malaria. Correct answer option D population at risk of malaria. Denominator of annual parasite index API is, correct answer population at risk of malaria. Explanation, API annual parasite incidence API equal to confirmed cases during 1 year per population under surveillance into 1000. So denominator of annual parasite index API is, correct answer option D population at risk of malaria. Next question, date of establishment of EPI is option A 1974, B 1978, C 1980, D 1988. Correct answer option A 1974. Date of establishment of EPI is 1974. Explanation, the year 2014 marks an important public health anniversary. It is exactly 40 years ago that the World Health Organization WHO established the Expand Program Immunization EPI. Since its launch, countries in the region of sub-Saharan Africa SSA have been found to be behind regarding new vaccine introduction and VI such as hepatitis B, HIB-CV, PCV, Rota and HPV. These vaccines have been developed in the era post-EPI establishment and are currently recommended by WHO for routinely immunization for all. Next question, date of establishment of IMCI is option A 1990, B 1995, C 1997, D 1996. Correct answer option B 1995. Date of establishment of IMCI is correct answer 1995. Explanation is Integrated Management of Childhood. Full form of IMCI is Integrated Management of Childhood Illness. Is a systematic approach to children health which focuses on the whole child. This means focusing not only on curative care but also on prevention of disease. The approach was developed by United Nations Children Fund and the World Health Organization in 1995. It includes both preventive components on the part of families and communities as well as curative action to be taken by health workers. It also has an objective to help improve health system. Next question 7. Date of establishment of DOTS is A 1995, B 1994, C 1998, D 1991. Correct answer option A 1995. Date of establishment of DOTS is correct answer 1995. Explanation is the DOTS report was released to the public on March 20, 1995 at New York City's Health Department. At the news conference, Tom Frieden, head of the city's Bureau of TB Control, captured a sense of DOTS. TB control is basically a management problem. Frieden has been credited for using the strategy to turn around New York City's TB outbreak a few years earlier. Next question, according to Alma-Ata, elements of PSC are option A 8, B 3, C 6, D 5. Correct answer option A 8. According to Alma-Ata, elements of PSC are correct answer is 8. Explanation is the Alma-Ata Declaration on PSC envisaged a minimum package of 8 elements: education concerning prevailing health problems and the methods of preventing and controlling them, promotion of food supply and proper nutrition, and adequate supply of safe water and basic sanitation. So, according to Alma-Ata, elements of PSC are correct answer is option A 8. Next question, measure of water vapor per cubic centimeter is A absolute humidity, B relative humidity, C both, D none. Correct answer option A absolute humidity. Measure of water vapor per cubic centimeter is correct answer absolute humidity. Explanation is absolute humidity units are grams of water vapor per cubic meter volume of air is a measure of the actual amount of water vapor in the air regardless of the air's temperature. Next question 10. Daily dose of thiamine for adults is A 1 gram milligram, B 2 milligram, C 3 milligram, D none. Correct answer option A 1 milligram. Daily dose of thiamine for adults is correct answer 1 milligram. Explanation is recommended dietary allowances RDA in adults: males 1.2 milligram daily, female 1.1 milligram daily. Recommended daily allowance RDA in pediatrics 1 to 3 years 0.5 milligram per day, 4 to 8 years 0.6 milligram per day, 9 to 13 years 0.9 milligram per day, males 14 to 18 years 1.2 milligram per day, females 14 to 18 years 1.0 milligram per day. Average adequate intake AI for healthy breastfed infants. Next question 11. John Snow located source of A cholera, B typhoid, C plague, D all. Correct answer option A cholera. John Snow located source of correct answer is option A cholera. Explanation is John Snow, 15 March 1813 to 16 June 1858, was an English physician and a leader in the development of anesthesia and medical hygiene. He is considered one of the founders of modern epidemiology, in part because of his work in tracing the source of a cholera outbreak in Soho, London in 1854, which he curtailed by removing the handle of a water pump. Next question. Overall meteorology of geography is known as A. Climate, B. Global warming, C. Climate change, D. None. Correct answer option A. Climate. Explanation is meteorology, scientific study of atmospheric phenomena, particularly of the troposphere and lower stratosphere. Meteorology entails the systematic study of weather and its causes and provides the basis for weather forecasting. Next question 13. CDM stand for A. Clean Development Mechanism, B. Community Development Mechanism, C. Clear Development Model, D. None. Correct answer option A. Clean Development Mechanism. CDM stand for Clean Development Mechanism. Its explanation is under the Clean Development Mechanism, emission reduction projects in developing countries can earn certified emission reduction credits and contribute to sustainable development. Next question. A method of comparing the monetary value of all benefits of a project with all cost of that project is known as A. Cost benefit analysis, B. Cost effective analysis, C. Cost utility analysis, D. Cost effective analysis. Correct answer option A. Cost benefit analysis. A method of comparing the monetary value of all benefits of a project with all cost of that project is known as, correct answer, cost benefit analysis. Explanation is benefit cost analysis BCA is a technique for evaluating a project or investment by comparing the economic benefits of an activity with the economic costs of the activity. Typically, we use the symbol B to represent our measure of benefits and the symbol C to represent our measure of costs. Benefit cost analysis has several objectives. Next question 15. In healthcare market, if supply increases, demand dash, A increases, B decreases, C first increases, then decreases, D remains same. Correct answer option B, decreases. In healthcare market, if supply increases, demand decreases. Correct answer B, decreases. Explanation: the law of demand applies to healthcare as in other markets. As the price of healthcare increases, you demand less of it. But we must be careful. What matters is the price of healthcare to you. If you have health insurance, this price may be much lower than the actual cost of providing you with care. Next question. Most common side effect of IUD is A. Bleeding, B. UTI, urinary tract infection, C. leucorrhoea, D. amenorrhea. Correct answer option A, bleeding. Most common side effect of IUD is, correct answer is bleeding. Explanation is most common IUD side effects in cramping and heavy menstrual bleeding. The minor side effects are listed as acne and weight gain. While these issues may be annoying and weight gain has the potential to become a serious problem, they usually pose to immediate health treat. Next question. Ineffective stage of Entamoeba histolytica is A. Trophogyte, B. Christ, C. Sporogyte, D. Merogyte, C. Correct answer option B, Cyst. Cyst is the ineffective stage of Entamoeba histolytica. Explanation is infection by Entamoeba histolytica. The infective stage of Entamoeba histolytica in the environment is the cyst. Cysts are resistant to desiccation, surviving in a dry environment at least 12 days at up to 50 degrees centigrade. They are able to persist in wetter environments for 30 plus days. Trophogytes cannot survive in the environment. Next question 18. Constant presence of disease in an area during a period of time is A. endemic, B. epidemic, C. sporadic, D. pandemic. Correct answer option A, endemic. constant presence of disease in an area during a period of time is correct answer endemic. Explanation is endemic refers to the constant presence and or usual prevalence of a disease or infectious agents in a population within a geographic area. Hyperendemic refers to persistent high levels of disease occurrence. Occasionally, the amount of disease in a community rises above the expected level. Next question 19. PNMR refers to A. Post-neonatal mortality rate, B. Post-natal mortality rate, C. Prenatal mortality rate, D. Prenatal mortality rate. Correct answer option C. Perinatal mortality rate. PNMR refers to correct answer option C. PERINATAL perinatal mortality rate. MORTALITY mortality rate. So PNMR refers to perinatal mortality rate. Explanation is perinatal mortality. The PNMR refers to the number of perinatal deaths per 1000 total births. It is usually reported or on an annual basis. It is a major marker to assess the quality of healthcare delivery. Comparisons between different rates may be hampered by varying definitions, registration bias, and differences in the underlying risk of the populations. Next question. A baby is called exclusively breastfeed if he is breastfed for A 2 to 3 months, B 3 to 4 months, C 3 to 5 months, D 7 to 8 months. Correct answer option C 3 to 5 months. Explanation is exclusive breast milk feeding is defined as a newborn receiving only breast milk and no other liquids or solids except for drops or syrups consisting of vitamins, minerals, or medicines. If the newborn receives any other liquids, including water, during the entire hospitalization, select allowable value. No exclusive breast milk feeding includes the newborn receiving breast milk via bottle or other means beside the breast. In this video, I have given information regarding 20 important questions of फॉर द इंट्रेंस एग्जाम ऑफ MPH मास्टर ऑफ पब्लिक हेल्थ के लिए 20 महत्वपूर्ण क्वेश्चंस बताए गए हैं जो कि विभिन्न यूनिवर्सिटीज और इंस्टीट्यूट्स के लिए होने वाले MPH एंट्रेंस एग्जाम जैसे कि एम्स, PGI, MER, चंडीगढ़, IIPH, TISS मुंबई, JIPMER पौंडुचेरी, IIPS निम्हांस बेंगलोर, JNU हैदराबाद यूनिवर्सिटी, लखनऊ यूनिवर्सिटी, ICMR और अदर इंस्टीट्यूट और यूनिवर्सिटीज़ के लिए होने वाले MPH एंट्रेंस एग्जाम के लिए बहुत यूजफुल हैं। और जो कैंडिडेट्स विभिन्न यूनिवर्सिटी और इंस्टीट्यूट्स के MPH और अदर कॉम्पिटिटिव एग्जाम्स की तैयारी कर रहे हैं और इसके लिए इंपॉर्टेंट क्वेश्चन के PDF नोट्स लेना चाहते हैं, ऑनलाइन कोचिंग ज्वाइन करना चाहते हैं, वो 9411513974 पे व्हाट्सअप कर सकते हैं। और कॉम्पिटिटिव एग्जाम्स की तैयारी के लिए एक व्हाट्सअप ग्रुप बना रखा है जिसका लिंक आपको डिस्क्रिप्शन बॉक्स में मिल जाएगा। चैनल को सब्सक्राइब अवश्य कर लें ताकि इंपॉर्टेंट क्वेश्चन के वीडियो मिलते रहें और विभिन्न जॉब्स और एडमिशंस के लिए जो नए अपडेट्स आते हैं उसकी जानकारी मिलती रहे। वीडियो को लाइक, शेयर और कमेंट जरूर कीजिएगा। वीडियो देखने के लिए बहुत बहुत धन्यवाद।